Psychiatry clinical tips for IMGs. Tip 1. Depression. Imagine a 28-year-old woman who feels low, has lost interest in work, and says life isn't worth living. The golden rule: in every patient with depression, always ask about suicidal thoughts. It's not just for exams, it's life-saving in real practice. Tip 2. Schizophrenia. A young man hears voices commenting on his actions, even when he's alone. This classic, running commentary, is a hallmark of schizophrenia. Remember, auditory hallucinations are more typical than visual ones in this disorder. Tip 3. Mania. A patient bursts into clinic, talking non-stop, hasn't slept in days, and is making grand business plans. Elevated mood, reduced sleep, and pressured speech. That's mania. Always think of bipolar disorder when you hear this triad. Tip 4. Generalized anxiety disorder. A 35-year-old teacher can't stop worrying about everything: health, family, finances. It's been going on for over 6 months, with poor sleep and restlessness. That's generalized anxiety disorder. Duration and physical symptoms are key exam clues. Tip 5. Panic attack. A patient suddenly feels chest pain, sweating, and says, "Doctor, I think I'm dying." 10 minutes later, symptoms resolve. Classic panic attack. But don't forget, in real life, always rule out heart disease first. Tip 6. OCD. A man washes his hands 40 times a day, driven by the fear of contamination. He knows it's irrational but can't stop. Obsessions are the intrusive thoughts, compulsions are the repetitive actions to reduce anxiety. That's OCD in one line. Tip 7. PTSD. A soldier back from deployment has nightmares, avoids crowded places, and startles at loud noises. Flashbacks, hypervigilance, and avoidance are the triad for PTSD. Always link it to a history of trauma. Tip 8. Delirium versus dementia. An elderly patient suddenly becomes confused at night, pulling out IV lines, then seems normal by morning. That's delirium, acute and fluctuating. Dementia, in contrast, develops slowly and doesn't fluctuate. Tip 9. Alcohol withdrawal. A man who stopped drinking yesterday now has tremors, sweating, and visual hallucinations. That's alcohol withdrawal. Treat with benzodiazepines. Key exam clue: symptoms begin within 6 to 24 hours of stopping alcohol. Tip 10. Lithium toxicity. A bipolar patient on lithium suddenly develops tremor, slurred speech, and unsteady gait. Always suspect lithium toxicity. Exam clue: check serum lithium levels. Normal is 0.6 to 1.2 mmol/L.